morning, everyone, and thank you for joining me here on the Washington Report. It's kind of scary for one to think that a young person can actually have a heart attack, and unfortunately, it is not unheard of. But what are we going to do about it? What do we need to know? What kinds of research do we need to do, and how can we be more aware? So joining me today to talk about these things and some exciting news as well is Jude, Maboné, and I have Lara Asch with me this morning. So thank you both for joining me.
Yeah, thanks for having us.
Thank you for having us.
Absolutely. So I'm going to start with you, Jude. Tell us a bit about yourself and your history, if you will.
Yeah, so I am a survivor. I had my first heart attack when I was 16 years old, and before I turned 18, I had 6 heart attacks. And so I'm one of the over 60 million women in the U.S. who's living with heart disease. But when people think about heart disease, I'm probably not what comes to mind. I'm a distance runner. I ran 4 years at American University. I'm still very active. I'm very healthy and very young. But the reality is heart disease can look a lot of ways, and that's why it's really important that we continue to educate people on what that can look like, what the symptoms are, and how to prevent them.
Jude, you said your first heart attack. You kind of got me there.
Yes. Yes, so I had my first heart attack during a 6-mile run back when I was 16 years old during summer cross-country practice. And, I was running, I started having chest pains, and then my chest pains became more severe. I had a headache, I was nauseous, I was profusely sweating, and I had gone to health class, so I knew the symptoms of a heart attack, but I thought, of course, this can't happen to me, I'm 16, I'm so young, I'm so healthy. But the reality is it really can happen to anyone.
Oh my goodness. And may I ask, have you had more? How many have you had?
So I had the 6 within a 2-year span. Ooh. Since then, I've been living really, really well. And, I always tell people that it's the work of the American Heart Association, good medicine, the grace of God that has kept me here. And so I'm doing really, really well. It's been over a decade since my last incident. But that's why I'm so committed to making sure that other people know how to best prevent these from happening to them.
Okay, so Lara, I'm switching to you now. Tell us about your journey, and why I'm having this conversation with you today.
So I personally do not have heart disease, but when I was 10 years old, I was diagnosed with high triglycerides, which put me at a very high risk for having cardiovascular disease in the future. And so I immediately realized I needed to change some things about my lifestyle, and I needed to implement new things within my diet. And so it became a really, really important thing for me in my life to share my journey and to share why I was taking care of myself, and to advocate that other teenagers should also be taking care of themselves and thinking about their futures.
Okay, so 10 is so young, and of course, for you, having your parents, there guiding you along the way, as well as you too, Jude, but to be diagnosed with high, cholesterol and high triglycerides at such a young age, so there had to be some indicators or something, or was it just routine blood work for you, Lara?
I think it definitely wasn't routine blood work. What we kind of realized was that I started getting a little bit insecure about my body, because I looked really different from a lot of other people at my school. And at first we were kind of just oh, it's just metabolism and it's fine, you'll be fine. But then my doctors started to realize that it was kind of starting to spiral out of control. I was, instead of weight gain distributing evenly throughout my whole body, it was really centered within my thighs and my stomach. And my doctor thought that that's something that it was a reasonable enough reason to look in, to do blood work, to see what could be the cause. And we went through multiple different things. At first we thought I had celiac disease, and so I went a week without gluten, but it ended up not being that. When we finally realized it was high triglycerides and high cholesterol, which has been kind of like, has a little bit of a genetic thing with my family, but it's also just kind of just for me as well.
Right. Wow. Jude, circling back to you, with all of those multiple heart attacks, what kind of journey was it for you? I mean, when you're saying that you're running, I can't imagine that you have the physicality differences, such as Lara has described about herself. So what is it that you can think back on that may have been an indicator?
I had experienced some chest pains before when I was exercising.
And when you say, I'm sorry, when you say chest pain, sorry to cut you off, what can you describe what you mean by chest pains?
It felt like I had pricks on my chest, like just really just a chest tightness. My breathing felt like I was constricted, like I was breathing through a straw. And that had happened a few times before, but I always brushed it off. And once I stopped running, like it always went away. And so I think that the warning signs were there that something was happening within my body, but I kept pushing it. I kept neglecting it because I thought, I'm so young, I'm so healthy. Like, my heart's fine. My heart has to be fine. Okay. So as I reflect, I'm realizing that I was probably seeing warning signs well before my first full-blown heart attack took place. I just brushed it off because I thought, this can't happen to a little girl. Like, I'm fine, you know?
Right. And so that kind of leads me to what we're here to even highlight even more. There's a campaign that the American Heart Association is involved with, and it kind of takes you guys to help push that message. And so, Jude, if you could tell us what is going on with the American Heart Association and you.
Yeah, so this is an amazing program called the Leadership Impact Campaign. And basically, it's a 7-week competition that really highlights, heart disease and really lets people know that it's the #1 killer of Americans and that stroke is the second biggest killer of Americans. And so what they do is they bring around a bunch of kind of like people like me and like Lara who are part of the community but have been impacted by the disease and are working in the community to try to advance heart health equity and try to change the way that people think about their heart health. And what we do is we raise money for the American Heart Association's life-saving work. And so last year, I was part of the inaugural campaign in D.C., and I really focused on the need to remove barriers to health through community initiatives, scientific research, and just advocacy policies in general. And so I really just leaned into my personal experience with heart disease to kind of like a wake-up call to people that what we view as heart disease, that stigma is not always accurate, and it's so important that we all lean in and take our own heart health seriously now.
Right, absolutely. And, I failed to mention that you're Miss District of Columbia 2023. And so,
yes, it was.
And so I could imagine that access for the platform just kind of made it a little bit easier to get out there, right?
Yeah, I mean, I was doing this work for a long time. The American Heart Association has been so supportive of my journey as I've been a survivor for over 10 years now. But being Miss DC absolutely helped because I was able to kind of reach out into spaces and say, this is more than just something that impacted me, Jude. Like it impacted, somebody that is an icon. Like Miss America is such an iconic brand. And so I could really leverage the crown and the sash to get people to kind of pay attention.
I like how you said you can use the crown and the sash. I've never heard that before. I kind of like that one. And Lara, how about you? What is it that you're doing besides an interview like this with me to help bring the awareness? What's your role here?
Well, I've kind of been working with the American Heart Association since I was like 10 or 11 when I started talking about like my journey with high triglycerides. I had an article written about me. I think it helped that because both my parents are cardiologists. I already had a connection with the American Heart Association established from a very young age. But this year they reached out to me and they asked me if I wanted to participate in the Teams of Impact campaign, which empowers young people to share their stories and talk about heart health. So it's a 9-week competition that it empowers young people to make a difference and take action for their own hearts and like their own health and of the people, of themselves and the people that they live with every day.
Both of you have described a competition, but I'm not too sure what the competition actually looks like. So I don't know if there's a difference between the Teens of Impact or the Leaders of Impact campaign. So Lara, can you tell me what the campaign or the competition looks like for teens?
Yeah, of course. So basically what I did was I had to, I was spreading awareness for multiple different aspects. Every week there was kind of like a different goal. Like one week it was like CPR awareness, so making sure that people that you know and like live with and like see on a daily basis know what CPR is, and now I know how to use CPR in like a necessary situation. And then others were kind of also just like keeping a healthy diet, exercising, and stuff like that. So, and so I was doing that every week. I was kind of advocating for a different issue, and with that, we were gaining points, but, and those points would later translate into donations. But I was also fundraising money at the same time, I was fundraising money that would help raise awareness of heart health and cardiovascular disease in the greater public, especially within teens and schools.
Okay, that sounds like really getting out there and involving people your age. How about for you, Jude, Leaders of Impact campaign? What did the competition look like for you, or was there a competition?
Yeah, so very similar format to the teen competition, except Leaders of Impact just takes community members. So it could be men or women or really anybody who's a part of the community who cares about preventing heart disease and cares about educating the community. And so it's really very similarly a lot of advocacy work around CPR and AED education, especially regarding cardiac emergency response plans in our public schools. And of course the fundraising component, because as I like to say, advocacy without action is not going anywhere, so you got to put your money where your mouth is.
Yes, ma'am. Absolutely. I do have a question about this CPR Act. What does that mean? Which one of you can speak on it? Or maybe both of you. Jude, I'm going to start with you.
Yeah, I'm happy to share. So over 350,000 cardiac arrests happen in the United States annually. And about 23,000 of those incidents happen to somebody who's under 18. So sudden cardiac arrest, which is, if you think about what happened to Damar Hamlin, the NFL player during Monday Night Football last year, sudden cardiac arrest is the #1 killer of student athletes and people under the age of 25. And so what we have been doing with the American Heart Association is lobbying the DC Council to introduce legislation that would essentially require cardiac emergency response plans in all of our DC public schools and public charter schools. And so earlier this month, I joined advocates at the DC Council for a hearing on the CPR Act, and the legislation would make sure that all of the district schools and their sports venues have a plan in place for responding to cardiac emergencies. Because like I said, this is extremely common, and it is the #1 killer of our student athletes. And so it's so important that we increase the odds for survival, because children who suffer from a cardiac emergency in school with an AED have about a 70% survival rate compared to 10% of survival rate for the students who do not. And so it is truly life-saving and life-critical work that this legislation is put in place, that every student athlete has the right to play, but also the right to live.
Oh, wow. My goodness. With this act, I guess I'm being totally ignorant. I'm thinking that because it is a school and because the children are being monitored and, under the supervision of adults in a building of which, they have to be, that these things would be in place already, like an AED. And, because I guess in our minds we think about the adults and what will happen to an adult and not a child or what will happen with a child, even though those kinds of emergency things are put in place. So I guess I'm being ignorant and not thinking that those kinds of things weren't already in place.
No, I totally get it. I mean, AEDs are required in our public schools. Like, they do have to physically have one. But what's not required right now is if a student if an athlete, if anybody in the school goes down with sudden cardiac arrest, again, the thing that happened to Bronny James, Tamar Hamlin, the thing that is killing the most of our student athletes, nobody knows what to do. There's no plan in place. And so what we're asking for is something that is drilled the same way that you drill a fire drill,
right,
where somebody knows that if somebody goes down, it's their responsibility to call 911. They know where the AED, somebody else knows where the AED is, and they go get the AED. Somebody starts CPR with the chest compressions. And so the goal is to have a plan in place so that it's seamless and it's smooth, because unfortunately when emergency strikes, people do tend to panic.
Right.
And these plans only help increase that survival rate for our student athletes.
So, Lara, for you, are you still currently in school at the high school level?
Yes, I am. I'm about to start my junior year.
Oh, look at you. It's going to be fun, I promise you. And so, what does your school situation look like? Are you involved with administration to ensure that these things are in place where you learn?
Yeah, I started working on that this year while I was still while I was still working with the AHA with the Teens of Impact campaign. I met with my principal and I was working with him on trying to establish a yearly either assembly where the entire school is educated on this kind of plan, and then I can't do anything personally, like one-on-one with my principal to get a plan or a practiced plan put in place, because that goes way above my principal on the school level with administration I've never met before.
Mm-hmm.
But I've been doing what I can, where I'm trying to establish a club within my school that teaches about heart health and CPR awareness and how to use an AED. And also, where even is the AED in my school? Because when I was working with Teens of Impact and I was learning about how I can use an AED, I realized I don't even know where it is in my school. And I spent the rest of that week trying to locate it in my school, and I did. And it was really interesting because I asked some of my other friends if they knew where it was, and they also didn't know. And I think that's another really important thing, that a lot of people just don't really know how to access an AED or just don't know how to do CPR in general, which I think is something that's really important and should be just established better in schools, including my school.
Oh yes, and this is summer, okay, but we're trying to shift and moving forward to being in a school atmosphere environment. And so when you were saying that, Lara, that it's kind of above where you can go, I would almost beg to differ on that, because you can approach a school board and ask for an audience, right?
Yeah.
And at your region level or whatever, and before you know it, Lara, you probably can impact your whole school environment, not just your little building, but your region entirely. So I would implore you to go ahead and take that extra step. It's amazing what we can do. Just because we're young doesn't mean we don't have ideas, right?
Yeah, exactly. I was actually starting to work on that, but then unfortunately the school year came to an end.
That's okay.
But I'm planning on getting back on that track when the school year starts, even though I'll have a new principal. But the principal has already worked in my school and the new principal is already working at my school in a different position. So he already knows a little bit about what I've been trying to do. And so I think it'll be helpful that I think this year I'll really be able to actually be able to talk to the school board or just higher administration that I haven't gotten the chance to contact yet.
Right. And you know what? I don't know if you have to do a capstone or not project, but I'm kind of seeing this senior project unravel in front of my ears here. Seeing it unravel in my ears.
I already had some ideas.
Right. Jude, what do you think about this approach? One school begets another school, and next thing you know, we're working towards something bigger.
Yeah, I think it's always so inspiring to hear from younger people who are, continuing to support this work and carrying on that message. So, hearing from Lara and her plans to kind of rally her school and get them on her cause, I think that's amazing and very inspiring.
Absolutely. And, I cannot imagine having to be in the shoes of either one of you with these life-changing situations, but the picture is not dull. The picture is bright when we have individuals such as yourself carrying this torch and sharing the message. Now, with the American Heart Association backing the two of you, Jude, what is it that you're hoping to see as far as how heart health is looked at?
You know, my goal has always been to break the stigma. It's like I said, when people think about heart disease, there's usually an image that comes to mind. And the reality is that is not really the case for most people. People usually think that heart disease is a symptom of problems that you created yourself by lack of exercise, poor nutrition, excessive smoking or drinking. But the reality is, for most people, that's not really their story. But there's also so many risk factors that we can all control. And so it's really important that you take control of your health now. Heart disease is not an older person's disease. It's just a disease that we tend to see later in life because of choices we made when we were younger. And so it's really just important to me that everyone is aware that this is something that we can all prevent now. It's something that we can work on fixing now. And yeah, there are some things that are beyond your control, but about 80% of the risk factors are within your control. And so to me, it's just continuing to dismantle that narrative and get people excited about living a heart-healthy lifestyle.
Jude, when you were coming up, did you learn first aid CPR or CPR at all?
I did, yes. So I learned it in high school health class, but not before I want to say it was like my junior year, my senior year. So, I mean, to me, that feels a little late. I think we could honestly start earlier with CPR education.
I think so as well. How about you, Lara?
So I got really lucky having parents that are both cardiologists. I kind of grew up in a house that was like, my parents were always talking about like heart health and how I could be better for myself. And that came with learning CPR at a very young age. I used to do little like CPR simulations with my mom that she would have to do regularly for her work, and I used to sit with her and do them with her when I was younger, and it's honestly one of the best memories I have with my mom, still to this day. And I think it shows that like I am one of like the smaller percentage of people at my school who actually know CPR, and it's because I was exposed to it at such a young age. But I know a lot, like my friends don't know it, except for one of them who took a lifeguarding course like last year, so she just learned it. But yeah, I think it's something that should definitely be introduced in schools at a younger age.
I concur, and I have a moment of reflection myself when I was younger and in Girl Scouts. It was a part of our earning a patch where there was a first aid section, and we did CPR, and I remember learning how to do a tourniquet and learning how to, count, and we had our first aid book and learning CPR and things like that. And I was quite young, but you know what it is? I think that people think that young people aren't capable. Like they can't handle such a daunting task. Am I wrong about that, Jude?
Yeah, I think you're right. I think a lot of people kind of have that perspective, but the more exposure you have, the more confident you'll feel when it is time to act. And so I totally agree with you that the younger and the earlier you can get someone exposed to this information, the more their confidence will grow. And then hopefully, should the event ever happen where they need to step in and help, they'll feel empowered to do so.
Yes, absolutely. It's getting close time for me to wrap up, ladies, and I've really thoroughly enjoyed this conversation. But before I go, I would like both of you to give some really powerful, easy for me not to say, words of, how should I say this, of encouragement, especially to our younger listeners or parents of younger listeners, the importance of not only knowing about it, but getting involved. How can they get involved? What can they do? Jude, I'm going to start with you here in the district of what it is that you're looking to happen for our individuals who might have heart disease or are known to have heart disease.
Heart disease is the number one killer of Washingtonians and Americans nationwide, and there are about 80% of the risk factors for that are in our control. And so my message to everyone is that it is so important to go check in with your doctor regularly. Don't skip your appointments. Like, don't skip getting your vitals checked. Don't skip your blood work. Go get it done. Make sure that you are in tune with your body. Make sure you're aware of your diet. Make sure you're moving your body as much as you can. And for anyone who is already living with this disease, know that it is not a life sentence. There is still a lot of good that can come beyond the diagnosis. And you are so much more than just your diagnosis. And I hope that anybody who is already living with heart disease the way that I am feels empowered and inspired to tell their story and to continue to live as well as they possibly can.
How about you, Lara? What would you suggest, especially for kids your age?
I think for me, I would definitely say take care of yourself and like advocate for yourself. If you think that there might be something wrong, like you aren't feeling your best one day, it's really important to not dismiss it and say and speak up to maybe a school nurse or a family member or your doctor on your yearly visit. Because honestly, sometimes like for me, something that could have really, really affected my life a lot more than it actually ended up affecting me, and it could have just gone unnoticed if I hadn't started speaking up for myself to my parents. I think really just, advocate for yourself if you think that that something might be wrong, and like never forget that even though you might be like an athlete like who's super, super into like soccer or track like Jude, like make sure that it could still happen to you. And I think just taking care of yourself and listening to your body is really what's important.
Yeah, I concur 1,000. 1,000%. And you know, that avocation that we're talking about, people my age still have a hard time advocating for themselves, and it's okay to push. If it makes somebody uncomfortable, that's them being uncomfortable, not you. You know, just even if you have to, what do they say? Tell it to the people in the back. Even if you have to yell from the back of the room, you know, keep that voice loud, keep it proud, and keep it moving. I thank you both very much for joining me here today. It's been an absolute pleasure.
Thank you for having me.
Thank you so much for having us.